Aphorism number 97. Other individuals of an opposite character, however, partly from indolence, partly from false modesty, partly from a kind of mildness of disposition or weakness of mind, refrain from mentioning a number of their symptoms, describe them in vague terms, or allege some of them to be of no consequence. Explanation. In this aphorism, Dr. Henneman has given idea about delicate-minded patients. Other individuals of an opposite character, due to partly from indolence, partly from false modesty, fake impressions, partly from a kind of mildness or of disposition or weakness of mind, they stop themselves from mentioning a number of their symptoms, or they describe the symptoms in vague terms, or if they describe some of the symptoms may be of no importance. Aphorism number 98. Now, as certainly as we should listen particularly to the patient's description of his sufferings and sensations and attach credence especially to his own expressions, wherewith he endeavors to make us understand his ailments, because in the mouth of his friends and attendants they are usually altered and erroneously stated. So certainly on the other hand, in all diseases, but especially in the chronic ones, the investigation of the true complete picture and its peculiarities demands special circumstances, special circumspection, tact, knowledge of human nature, caution in conducting the inquiry, and patience in an eminent degree. Explanation. In this aphorism, Dr. Henneman has given idea about constitutional investigation, human knowledge. Now, as certainly we should listen particularly to the patient's description of his sufferings and sensations. We should pay full attention when patient narrate his sufferings and sensations, and here we should attach credence, some notes, or our understanding especially to his own expressions, through which he takes efforts to make us understand his ailments or sufferings, because sometimes narration of his friend and attendants about his sufferings or sensations are usually altered and wrongly stated. So certainly on the other hand, in all diseases, but especially in chronic diseases, the investigation of the true complete picture and its peculiarities, they all demand special circumspection, cautiousness, tact, skill, knowledge of human nature, caution in conducting inquiry, and patience in an eminent degree. Aphorism number 99. On the whole, the investigation of acute diseases or of such as have existed but a short time is much the easiest for the physician, because all the phenomena and deviations from the health that has been but recently lost are still fresh in the memory of the patient, and his friends still continue to be novel and striking. The physician certainly requires to know everything in such cases also, but he has much less to inquire into. They are for the most part spontaneously detailed to him. Explanation of 99. In this aphorism, Dr. Henneman has given idea about acute diseases. On the whole, the investigation of acute disease or diseases which have existed since short time is much easiest for the physician because all the phenomena and deviations from the health that has been developed recently and all the changes or alteration in the state of health are still fresh in the memory of the patient and his friends and relatives, and they are still new and striking features for them. The physician certainly requires to know everything in such cases also, but he has not to inquire too much because patient and his attendants describe them in detail and very spontaneously.